DEXA. What is it? DEXA is short for dual emission X-ray absorptiometry or dual energy X-ray. This type of diagnostic test measures bone density and the amount of minerals or calcium in the bone. It is also used to detect any muscle mass loss, which usually happens and leads to bone loss. The purpose of DEXA is to research and prevent bone loss. The amount of radiation is minimal, so the technologist can actually sit next to the patient while they are being scanned. Since this is about 10% of a regular X-ray, according to Kaklian, or 0.001 millisieverts. How does it work? As the name implies, there is two X-ray beams used and each has a different role. One X-ray beam is used to measure soft tissue and the other for the bone. The beam that is not as intense penetrates through the soft tissue and the other intense beam through the thick bone. The C-arm can be moved along the table where the patient will lay down and the desired area of interest will be scanned. Once the scan is completed, there are two results to look at. One is the T-score, which compares bone density results with the average optimal healthy bone density in the same sex, which is usually about the age of 30. The Z-score compares the results with the same individual's age, sex, ethnicity, and other related factors. So again, the first score measures the optimal bone density in the same sex. The second compares with similar patients. The results will show red as a potential concern and green in good, healthy condition. The areas of the body that are viewed in this field are mainly the lumbar spine, including the neck, hip, forearm, and the whole body, according to Marissa Crew. The reason is because these areas are the most susceptible to osteoporosis, and the goal is to prevent a life-altering fracture in these areas. For who? According to a research article by Dr. Colin Tidy, women generally get more DEXA scans than men when they are in menopause. This means the women's reproductive hormones end, for example, their menstrual cycle. This usually lasts 12 months from their last cycle. Women that are also above the age of 65 get DEXA scans since their bones are more fragile than men's. And according to N.R. Wells, who compiled a medical document, anyone that has a natural deficiency such as arthritis, hyper or hypothyroidism can get a DEXA scan. The main purpose is to screen for osteoporosis, which means the bones become more fragile and break easily. Several reasons could be a lack of calcium, vitamin D, and change in hormones. And with a DEXA scan, we can go ahead and conclude what the patient needs and conduct and formulate a good plan to resolve their issues.